3 new cases of the Wuhan coronavirus have been identified here in Singapore, taking the total now to 10. All are Chinese nationals from Wuhan. The 8th and 9th cases are both 56 years old. They are a married couple who arrived in Singapore on the 19th of January. Now, they developed symptoms 5 days later and took a taxi to Tan Tock Seng Hospital on Monday. They were immediately isolated at the National Centre for Infectious Diseases. The wife tested positive for the virus last night and her husband this afternoon. Now, before going to hospital, they stayed with their family at their home in Lorong Lulien. The 10th case is also a 56-year-old Chinese national. Now, he arrived from Wuhan on the 20th of January and developed symptoms a day later. He was identified as a suspect case yesterday at a health screening station at Marina South Pier and was admitted to the Infectious Diseases Centre. He tested positive for the virus this afternoon. Now, he worked and lived on board a cargo vessel. Meantime, contact tracing for these new cases, it is ongoing. Now, the Health Ministry says that all 10 patients are in a stable condition and most of them are improving. The latest figures indicate that 124 suspected cases here have tested negative. Test results for the remaining 70 cases are pending. Now, the ministry has also identified 144 close contacts, of which 115 who are still here in Singapore. 111 have been contacted and have been quarantined or isolated. Now, efforts are still ongoing to contact the remaining 4 people. Now, meantime, the Health Ministry says that it remains concerned over the increase in cases both overseas and here in Singapore, adding that the worldwide spread of the virus appears to still be in its early stages. It adds that the next 2 to 3 months, they're going to be critical, although in Singapore at least the situation appears to be controllable. The Health Ministry's Director of Medical Services, Associate Professor Kenneth Ma, shared these insights in an exclusive interview with CNA's Cheryl Goh.
From whatever information you've gathered in Singapore to date, do you have any indication on the severity of the virus?
The situation overseas is clearly of concern, with the number of infected cases continuing to increase at a very high rate, and it seems to be accelerating. In Singapore, we continue to make diagnosis of such cases, and the number continues to increase. But as yet, it seems still to be a controllable situation. We have not seen any Singaporeans infected to date. There's no signs of any transmission in the community. And these are, in fact, perhaps facts that make us hopeful that it's still possible for us to contain this infection as it presents in Singapore. And that's important, therefore, for our containment strategies.
Are you able to tell us about the status of the existing cases and how they are doing at the moment?
Yes. It's difficult to tell you about the first 3 cases. They've just been admitted, or rather the most recent 3 cases, they've just been admitted. But of the remaining patients that were previously admitted and continue to be in hospital, all of them are stable. In fact, none of them are critically ill, and they all make good progress. Unfortunately, none of them are at a stage where we are ready to certify them as free of the infection, and therefore they continue to be hospitalized at the various hospitals in Singapore.
What kind of a time frame are we looking at? Are we looking at a few months, How long more can we expect to deal with this virus?
Yes. The international experts that have advised us not to be optimistic for a very short duration. With the number of cases that are present both in China and in the world, we're not sure whether, in fact, the disease has peaked yet. And this may, in fact, still be in a relatively early stage. It would not be surprising, in fact, if we have to continue to be on our guard through the next 2 to 3 months.
Could you also just help to clarify to the public on the use of masks? So we know that if you're unwell, yes, it's a given, you need to wear one. But what if you are a healthy person? Would wearing a mask help to prevent the disease?
For the general public who are not having any symptoms at all and they're very well, there is no requirement to wear a mask. it's in fact the people who are not well, who have respiratory symptoms, that we recommend should wear a mask. And the reason why we want them to wear masks is because we don't want them, therefore, to spread any infection to other people. And this is a good hygiene measure. We know that in this particular case, the infection is spread through droplets when you cough or you sneeze. And therefore, wearing a mask protects other people because it traps those droplets and prevents those droplets from spreading and disseminating. A surgical mask is in fact sufficient for that purpose, and a surgical mask, if worn properly, in fact fulfills this important function of preventing a spread. It's important to wear that mask properly, and there are instructions available on how to wear a mask. The mask should be changed if the mask gets soiled and stained, and anyone who in fact has symptoms should make their way as soon as possible to see a doctor to make sure that they remain well.
I was going to ask, how often do we need to change the masks? Yeah.
In general, as long as the mask is kept well, it's not stained, it's not dirty, it's not soiled, that mask can be used for most of the day. Often we would estimate that that mask could last for at least 6 to 8 hours. But whenever that mask becomes stained and soiled or wet, that mask would no longer be effective, and it's important for that mask therefore to be changed. When changing a mask, it's important also to make sure that the dirty mask is disposed of properly, and it should not be left by the side in exposed areas, because that in itself could be a risk of infection spread to other people.